Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Osteogenic Sarcoma. Introduction. Osteogenic sarcoma, also known as osteosarcoma, is a type of bone cancer. It usually first appears in the ends of long bones. Bone development and growth happens around the ends of long bones in young people. Osteogenic sarcoma happens most often to people between the ages of 10 and 19. The earlier osteogenic sarcoma is detected and treated, the more likely the chances are for a successful treatment. This program will help you better understand osteogenic sarcoma. It also discusses treatment options. The bones. Bones are made up of different kinds of tissue. Osteoid, cartilage, fibrous. Osteoid tissue is compact. It forms the hard outer layer of bone. A tough, flexible tissue called cartilage is found at each end of a bone. It acts as a cushion. Fibrous tissue is thread-like. It covers the outside of the bone. Long bones have a space in the middle. This space is called the medullary cavity. Bones are also made up of bone marrow. Bone marrow is soft, spongy tissue. It is found in the center of most bones in the medullary cavity. Two types of cells are found in the bone, the osteoblasts and the osteoclasts. The osteoblast cells create new bone, while the osteoclast cells break down old bone. This process is constantly happening in our bodies. Osteogenic sarcoma. The body is made up of very small cells. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing in an uncontrolled way. This causes an abnormal growth called a tumor. If the tumor does not invade nearby tissues and body parts, it is called a benign tumor. A benign tumor is a non-cancerous growth. Benign tumors are usually not life-threatening. If the tumor invades nearby tissues and body parts, it is called a malignant tumor or cancer. Cancer cells spread to different parts of the body through blood vessels and lymph channels. Lymph is a clear fluid produced by the body that drains waste from cells. It travels through special vessels called lymph nodes. Cancer that moves from one tissue to other body parts is known as metastatic cancer. For instance, a bone tumor may grow through the bone's outer layer and to nearby tissues over time. Cancers in the body are given names, depending on where the cancer started. Cancer that begins in the bone will always be called bone cancer, even if it spreads to other places. Osteogenic sarcoma is the most common type of bone cancer. It usually starts in osteoblasts. Osteogenic sarcoma commonly forms in the ends of the long bones of the body, which include bones of the arms and legs. In children and teenagers, it may form in the bones near the knee. Rarely, it may be found in soft tissue or organs in the chest or abdomen. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Risk factors. It is usually impossible to specify the cause of cancer in an individual patient, but we do know what causes cancer in general. Some risk factors can increase the chances of getting cancer. Age is a risk factor for osteogenic sarcoma. This type of bone cancer is most common in teenagers. Certain medical treatments increase a child's risk for developing osteogenic sarcoma. These include high-dose radiation therapy, certain anti-cancer or chemotherapy drugs. Children who have had hereditary retinoblastoma are at a higher risk of developing osteogenic sarcoma. Hereditary retinoblastoma is an uncommon cancer of the eye. It usually happens in children that are younger than 5 years of age. Another type of hereditary defect that increases the risk for bone cancer is Li-Fraumeni syndrome. Li-Fraumeni is a rare syndrome. It greatly increases a person's risk for developing many types of cancer, including osteogenic sarcoma. Another risk factor for bone cancer is Paget's disease. Paget's disease is a chronic or ongoing condition. It causes the increased breakdown and growth of bone. Paget's disease affects the normal cycle of bone development in the body. Other rare conditions that can raise the risk of osteogenic sarcoma include Bloom syndrome, Diamond-Blackfan anemia, Rothmund-Thomson syndrome, Werner syndrome. Not everybody who has risk factors for cancer gets it. Some people who have known risk factors for cancer can still get cancer. Symptoms. Pain in a bone or joint is the most common symptom of osteogenic sarcoma. Other symptoms may include a bone that breaks for no known reason, swelling over a bone or bony part of the body. These symptoms may not be caused by osteogenic sarcoma. Make sure to see a healthcare provider to find out what is causing your symptoms. Diagnosis. Your healthcare provider will ask you about your personal and family medical history. You may also have blood tests or other lab tests to rule out other causes of your symptoms. A physical exam will be performed. X-rays of the bones can help show the location, size, and shape of a bone tumor. A bone scan is another test that may be used to diagnose osteogenic sarcoma. During this test, a small amount of safe radioactive material is injected into a blood vessel. This makes the bones easier to see. Other tests that may be used to diagnose bone cancer include CT scan, MRI. A biopsy may be performed to diagnose bone cancer. A biopsy is the removal of cells or tissue for examination. A pathologist uses a microscope to look for cancer cells. A biopsy is the only sure way to know if cancer is present. Staging. If you have osteogenic sarcoma, your healthcare provider will determine the stage of the cancer. Staging is an attempt to find out if the cancer has spread, and if so, to which parts of the body. When staging bone cancer, healthcare providers want to find out the size, shape, and location of the tumor, whether the cancer invades nearby tissues, whether the cancer has spread, and if so, to what parts of the body. Stages are usually described using the numbers 1 through 4. A lower number indicates an earlier stage. Staging is helpful in deciding the best course of treatment. Sometimes osteogenic sarcoma is divided into two categories, localized or metastatic. Localized osteogenic sarcoma is seen only in the bone it started in, and possibly the muscle, tendon, or fat next to the bone. Metastatic osteogenic sarcoma has spread to other parts of the body. Most often it spreads to the lungs, but it can also spread to other bones, the brain, or other organs. The same tests used to diagnose osteogenic sarcoma can be used to determine the stage of the cancer. Treatment and supportive care. The type of treatment for osteogenic sarcoma depends on the size and location of the tumor, the stage of the disease, the health of the patient. Treatment for osteogenic sarcoma may include surgery, radiation therapy, chemotherapy, stem cell transplant, targeted therapy. Some combination of these treatments may be used. Surgery is the most common treatment. It often involves removing the cancer and some of the healthy tissue around the cancer. Radiation therapy uses high-energy X-rays or other types of radiation to kill cancer cells or keep them from growing. Radiation therapy may be used in some cases after or instead of surgery. It may also be used in combination with other treatments. Samarium is a type of radioactive drug that can reduce bone pain in patients with osteogenic sarcoma. Chemotherapy uses drugs to kill cancer cells. Chemotherapy may be given in the bloodstream through an IV or taken by mouth. It can also be placed in a specific area of the body. The type used depends on the type and stage of the cancer being treated. A stem cell transplant is another treatment option. During a stem cell transplant, stem cells are given to a patient through an infusion. These stem cells grow into and restore the body's blood cells. Targeted therapy targets specific differences in cancer cells to try and prevent the cells from growing and spreading. Some forms of targeted therapy are being studied in clinical trials. Cancer and its treatment can lead to other health problems. It is important to have supportive care before, during, and after cancer treatment. Supportive care is treatment to control symptoms. The goal is to relieve the side effects of therapy and to help you cope. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Osteogenic sarcoma, also known as osteosarcoma, is a type of bone cancer. It usually first appears in the ends of long bones. Bone development and growth happens around the ends of long bones in young people. It happens most often to people between the ages of 10 and 19. Certain medical treatments increase a child's risk for developing osteogenic sarcoma, such as high-dose radiation therapy. Children who have had hereditary retinoblastoma, Li-Fraumeni syndrome, or Paget's disease are also at risk. Pain in a bone or joint is the most common symptom of osteogenic sarcoma. Other symptoms may include a bone that breaks for no known reason, swelling over a bone or bony part of the body. The earlier osteogenic sarcoma is detected and treated, the more likely the chances are for a successful treatment. Treatment for osteogenic sarcoma may include surgery, radiation therapy, chemotherapy, stem cell transplant, targeted therapy. Talk to your healthcare provider to learn about the risks and side effects of these treatment options. Thank you for using Explain.